Today we have come here at ILS Hospital, Saltlake, Kolkata to talk to Dr. Ghanshyam Goyal, who is an eminent cardio-diabetologist. He had participated in the world's largest diabetic health screening, which happened in 27 locations in a day throughout the entire India, earning its place in the Guinness Book of World Records.
Actually, each and every patient across the globe, especially recommendation is in the males at the age of more than 35 and the females more than 40, they should be screened. And in the increasing incidence of air pollution, as it's increasing due to increased traffic and other issues, we should screen all these patients, and these patients should screen for measurement of blood pressure, measurement of diabetes, measurement of cholesterol, and body mass index, BMI. And if you find that these patients are in any problem, we have to immediately take the action. Because nowadays we see younger patients even 25 years of old having type 2 diabetes. So if you will not control properly all the risk factors, then they are not going to live a longer and quality life. Otherwise they may have complications.
Thank you so much, sir. As sir talked about diabetes, my next question to Dr. Goyal.
As first I am going to talk about the type 2 diabetes. Type 2 diabetes is a complex disease, I will say. It is due to multifactorial family history. If your parents or grandparents are having diabetes, you are prone to develop diabetes. Then obesity. If you are fat, obese, then you are having more chances to develop diabetes, type 2 diabetes. And then sedentary lifestyle. Because nowadays, as we see, we are just eating the potato chips and seeing the TV all the time, and just by doing the remote control, everything. So we are not doing exercising. These all factors lead to type 2 diabetes. Regarding the type 1 diabetes, it's a pure disease where it is an autoimmune disease, or due to the damage to the beta cells in the pancreas, it occurs. About that, you never know who is going to get it. If family history is not there, patient is having some viral infection and they got type 1 diabetes. But nowadays, with the advent of good quality of treatment, in the sense about the monitoring, we have got good quality of the monitoring systems, that is known as flash glucose monitoring or CGMS. You can monitor, and the insulin or insulin pumps can be used for type 1 diabetes. So important aspect is type 2 diabetes, where we should prevent it. Prevent in the sense, we can patient, if you advise good activity, physical activity, daily walking of 40 minutes to 1 hour, and then calorie intake or restriction, and stress curtail by doing yoga practices, that all helps, and reduction of weight is prevent diabetes, type 2 diabetes.
Thank you so much, sir. Sir, as you talked about the youth taking a lot of stress in their daily lives.
The most important is diabetes, then blood pressure, heart problems, anxiety, depression, and then you see anxiety, neurosis, depression. All these are the multiple, and it is a vicious cycle, and which is having all the consequences, chronic consequences. They will have inadequate sleep, that is due to that sleep deprivation syndrome will be there, and they may have increased risk of diabetes, heart diseases. These are all non-communicable diseases, because initially when we got independence, at that time the communicable diseases were more common, and now it's non-communicable diseases which are causing more burden to the society and to the country.
Thank you so much, sir, for your precious time. I'm sure our youth would be aware and take all the precautionary measures suggested by Dr. Goyal.